The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Hello, George. It's Tuesday morning. It's time for another great episode of the Pediatric Lounge. Who do we have with us today?
Today we have another great physician that we want to elevate. Her name is Dr. Martha May Sissa. And her topic today is going to be, she named it herself, I just love my pediatric private practice, wins from the field. I love to hear these great private practice stories, these feel-good stories, because I'm tired of the doom and gloom stuff. So take it away.
Welcome, Dr. Sissa. It's such a joy to have you on the program today. Are you in Texas today?
Good morning. Thank y'all for having me. Believe it or not, I am not in Texas. I have taken one of my first vacations since opening, and we're at our family farm in Tennessee. It's my boys' spring break. And so I have help holding the fort down back in Texas. So we came up here for the week. For me, part of the week. I'm going to go back on Thursday.
Very nice.
Well, spend time with your family. It's important.
Is it a large farm?
It's several hundred acres, and my husband does a lot of the work whenever he can get up here, and there is timber and it's very wild, and his mom actually has some pasture and leases it to a neighbor, and they have cattle on there, and my husband's getting cattle as well. It's a very different feel when I come up here, and the boys love it, but
it's good.
I'm slowly learning about this type of stuff.
Must be so peaceful up there.
It is.
I guess it's like Yellowstone, the series.
Right.
The Dutton Ranch.
In his dreams.
Those guys in the Dutton farm, I guess it's private practice where they used to have the small ranch that slowly evolved, and they're having a hard time developing as they move on into the future.
Yeah.
So,
analogy.
Yeah. But they're making it work just like you are making it work with private practice.
So we always like to start by, why did you become a pediatrician?
In my childhood, I always wanted to be a helper. And my mom's family is actually of Middle Eastern descent. So my mom is Lebanese. And in that culture, you're either going to be a doctor or a lawyer or a nurse. And it's just what you're going to do. And I have that people-pleasing personality, but I'm also a helper. So I just wanted to elevate myself. And so I really enjoyed science. And so I have an uncle with a doctor, so I wanted to follow in his footsteps, and I wanted to be a helper. And then I got to college and I got on that path, that pre-med path, and I did question it a little bit in the middle, and then I with doing some other occupations. And so I came out still wanting to do medicine. And then pediatrics, I was more in line with the personalities of pediatricians. So I love kids, love working with families. And so it was more so me really feeling like that's where I fit in the best, and wanting to kind of I've always wanted to be a mom myself. And so I felt very connected to moms in residency and medical school. And so that's the evolution of it. It's like at the end of the day where I felt like I fit best.
I think you picked up the best profession because you got the coolest job in the world. You're the most popular physician of all domains, and everybody loves their pediatrician. You do have it.
Well, it's awesome. I'm at this stage because I've been in practice for 9 years now. So a lot of the, especially the toddlers are starting to come in, and even 8 and 9-year-olds. Oh, I want to be Dr. Sissa, or I'm going to dress up like this for Halloween. And it's fun in a way to even be able to feel like I'm elevating them. I'll joke around and say, all right, you come back in 20 years. I'll have a job for you.
Yeah. And so you did your residency in Alabama?
I did. UAB in Birmingham.
Wow. How was that? You must have loved it out there.
I did. I have several best friends from college that are from Birmingham. And it was a great training environment. And it's where I met my best friends for sure. One of them in which is getting married in a couple months. And so I'm going to be in her wedding. And the training was awesome.
Wow.
Right.
And you moved to Houston to join a large practice?
I joined a middle-sized practice. It was a middle-sized private practice, mid to large size. And I worked there for 9 years.
What did you find that were the advantages? And I don't, mid, do you mean 5 pediatricians to 10 or
There were 8.
8? Okay.
It's a good size.
And so what did you find that were the advantage of such a practice?
The advantages of having a private practice where there were so many docs is that coverage was easier for sure. So I'm missing that now. And where you can really request off and get pretty much most holidays that you want. The coverage was definitely easier. And then collaboration. So being able to just go 2 rooms down and pick another doctor's brain about a clinical case.
Yeah. And then you decided to open up your own practice. What was your vision? What motivated you to take, and it's a lot of work. So what motivated you?
Yeah, it is. It's a lot of work. And I got that question a lot when I was preparing for this. And even now, I think self-talk is a big thing. And I have sometimes those questions come into my head. Why am I doing this? I really wanted to be able to have my hand a little bit more in the vision of a practice. And my husband is very entrepreneurial. He's the one that really helped me formulate my thoughts. I wanted to be able to see the fruits of all of my labor. I wanted to be able to create something that was going to withstand time and have a little bit more of my, I guess, my personal touch on it, being able to one day have different aspects of the practice that I hope I can still make work with Mayville, maybe parenting courses or support groups for moms. I wanted to be able to have that creativity within the practice. And then my husband, who is more kind of the financial overseer, he encouraged me just in terms of our family and being able to have some of the financial benefits. And I would say for me personally, it was always a dream. I think when you're little, you have this idea of what a doctor is. And when I went to a doctor growing up, it was Dr. Shockey. And that's just where I went. And I didn't really know that he was a member of a large group or a hospital-based doctor. And so I always thought that's what it was going to be. And then I came out of residency and I was told that's not really what happens anymore. And where I trained, most of the doctors had been bought out by larger groups. So I just assumed that's what you do. And so it wasn't until my husband started really helping formulate some business plans where I entertained the idea that this could happen. It's something I always wanted to do. I thought wasn't a possibility. And then
You did it.
just decided to do it.
Now, I have a question. So you're in a larger group, right? Was it a hospital owned or was it a private practice?
It was a private practice.
Okay. So I've known you for 15 minutes. I already can see you're entrepreneurial, you're business savvy, you're a good doctor. That's expected. People like you, you have ideas. Why would they not pull you into the fold?
I'm not quite sure. And I think probably the business concept of the way the practice was run, it just wasn't maybe in their business plan.
They don't even know it wasn't in their business plan. How many older guys were there?
There were 2.
2 older guys. And how many partners were there?
2.
So there was them, 2 older partners.
Yeah.
That's why. And you were a lady.
Yeah.
I know I got to push back on that. I see this all the time. It doesn't matter if it's a woman owner or a male owner. There's people that stop growing and they don't want to learn and they don't want to change. And they may be 30 years old or 70 years old. Conversely, there's people that are 75 years old or 80 years old and they're still willing to learn new things. And unfortunately, when you're making money and everything is going okay, and you're not into learning, you've been doing it for 15 years this way, it's really hard to get that person to change anything that they do. They drive the same car they've driven for 15 years. They live in the same house. They're in the same office. They have the same routines, and not their spouse, not their kids, not their colleagues at work can get them to change. I don't think it's so much a male characteristic, because I've seen many women-led practices in my area that flounder because the founder of the practice is a very competent, smart pediatrician, but she's just not willing to change. And they bury the practice just like the males do.
Yeah. I've always learned that, even in my signature and emails, the most dangerous phrase in the private practice medicine is, "We've always done it this way." So I joined as a junior, lots of seniors, and I felt every step was a battle, an uphill battle. Because I grew up in the time of paper, and then we converted to EHR and all that other stuff that came with it. I had statements as, "Don't do anything. As long as my name is on that banner, you can't do anything." Or, "Why would we do this? Because we're fine for all these years. Why do we need an EHR? We're not going to get an EHR until I retire." So you had to somehow convince these guys change.
Yeah.
Our practice is 60 years old.
Yeah.
I haven't been practicing for 60 years.
It's amazing.
Yeah.
Yeah, it's a
Change.
difficult challenge.
Yep.
What do you think sets your practice apart from the other practices in town?
I really enjoy personalizing the care for every family. And I know other pediatricians do that. And I was looking over and thinking about what I was going to say about my practice. And I think just the ability to really not treat patients based on an algorithm. I think part of what I want to do is be able to have a little more time with families. That's tricky because you have to see so many patients a day really to make it work. But I think around town, certainly most of the practices are hospital owned. So there's certain constraints just with regards to who you make a referral to, or if you do a sick visit and a well visit together. Certainly some of those things we can personalize, and we can really treat each patient individually. But I think that if you asked my families and my patients, it's really just the way they feel when they're in the room with me or my coworkers. I have a nurse practitioner, and I do have another doctor that's joined. And so that's been awesome. But when they're in the room, they feel with me just a sense of empathy. I'm a touchy-feely. And so I really connect, and with the moms, especially. Certainly I connect with dads too, but I think that just I'll call parents back at night. I'll call them on the weekend. And I do think that they feel that, and they've certainly told me, and that means a lot. So I think that element of the, in the room, me not really being afraid to be vulnerable with parents, they get a lot of that from me.
Is your practice technologically advanced with computers and portals?
Yeah, so
things?
it is. They really have found that the portal is a nice option. Parents like knowing that we can interact that way. And we also allow them just to email the nurse email site, and then the patient portal. They'll message us from that in the middle of the night, and they know that we'll respond in the morning. We have after hours calls, of course, but they enjoy that. I offer telemedicine for simple things like a rash, and we have Saturday hours as well. And so I think parents like that.
They do. I can tell you the hottest day of the week is Saturday.
Yes.
The hardest day to man with a physician is Saturday.
Yeah.
That's the problem.
Sunday's worse.
Sundays, that's whatever. But Saturdays,
Sundays.
the
And
doctors don't like working on Saturday.
Yeah, no.
The interesting thing is I have this discussion with my doctors all the time. You mean I have to work on Saturday? I say, but you have a day off during the week, Tuesday. Like, I have the day off on Tuesday. I have my podcast every Tuesday. I need a contractor to fix something. I'm home on Tuesday. They don't like that, but it's the same generation of doctor, that mother that wants the Saturday appointment.
For sure. Yeah. Saturdays are definitely a hot commodity. Yeah, Tuesdays and Wednesdays, a lot slower.
Yeah, so you take off that day.
And I also see newborns in the hospital, I forgot to mention, and I do feel like that sets us apart.
Wow,
So
that's so important because let me
and
tell you, I had seen patients,
yeah,
and then when they come to their checkup for college, the mother with a tear in her eye says, Dr. Rogue was the first doctor to have ever seen you when you were born.
exactly.
It's no financial gain, but it is priceless. And actually, I wrote an email I'm an instructor for a medical school here in Long Island, and I wrote requesting 4 students to come rotate with me next year. All of these students were patients in our practice, and I had seen them as newborns.
It's
Isn't that
amazing.
cool? Is that not cool?
And I know you're probably on a lot of the portals and the groups where private practice doctors talk amongst themselves, and it seems like everybody's leaving the hospital rounds. And it's parents love it, and it's where I get a good bit of newborns, actually.
Yeah,
So not only one hospital, I round at 3 hospitals in Houston. So it makes it very tricky in the morning, but we're setting the practice up where we're making it work right now. I've found that parents, it's very valuable.
it is. But it does make it a little tricky because going to 3 places before going to the office, sometimes for one patient driving too far, and everything in Houston is big. It has to be a long distance unless it's in that medical complex area. But sometimes it's not worth for one patient to drive 20 miles, 30 miles.
Yeah, no, not. And the other 2 that I go to, it's very few and far between that I'll have a newborn there.
Yeah.
And we have the privileges now, but as y'all know, I opened in April, so a lot of this is a work in progress. So if it
Yeah.
becomes too much, I'm going to have to let one
Yeah.
of them.
Yeah. The one that doesn't have too many newborns, you can let go. But you have to keep your foot in the door because it makes you influential in the community and the hospital system. The hospital will come to you for advice, you know?
Yeah.
Yeah, I don't know about that. These health systems are so big now, and they have their own echo chambers that they get ideas from.
I know, but as they say, keep your friends close, but your enemies closer.
Yeah, I don't know that they're enemies. I just think that they listen to consultants that they pay big bucks to,
Yeah.
and they forget to listen to the people that actually could help them with the solutions. Anyhow, you seem to be very relationship based and very compassionate. That comes across not only from talking to you, but from just reading your website. You seem to be a very kind and empathetic person, and that's nice to see in the exam room. I think those are the values that show quite a bit through your practice. There was a difficulty when you were a solo practitioner. Now you got an associate and a nurse practitioner. How do you keep up with all the reading, different guidelines, the different practice management aspects of the practice? How do you find the time to do all of that and then have a husband and kids?
Right now, I don't have a lot of bandwidth, to be honest. So I'm enjoying this time at the farm and glad they're holding the fort down, but I've been burning the candle at both ends. I know there's a light at the end of the tunnel. I just don't know when it's going to come, but I'm sure you guys have a lot of thoughts on this, but it's hard to just find a practice administrator. You can't just go on Indeed.com and find somebody that's trustworthy. And so it is all on me. So it's been taxing. I enjoy exercise in order to I get up early and I just get myself ready for the day. So that's been helping me just with self-care. But I've been doing most of the administrative work either after the boys are in bed or on a weekend. Figuring out how to aggregate tasks has been important for me. So if I know it's something that's pressing, I'll just have to put it on my to-do list and get to it because the emails just keep rolling in and it can be a little distracting if I'm in the middle of one task and then I go to another. For example, just yesterday, I was on the phone with our malpractice company to tell them I needed to get everybody on a group policy and I need to figure out how to get it paid for the year and get it done now because there's email chains and there's back and forth and it's a lot of distraction. So the administrative tasks, most of them are on me, but I'm trying to figure out who the contact point is and then try to get it done in a timely manner. Now, what I'm doing, and hopefully we find the right person to be an administrator, is I'm trying to keep a list of the things that I'm doing and a job description so that eventually if someone trustworthy I find, I can try to offload some of that to them. But in terms of finding the time, Usually these types of things are either on a Wednesday when it's slow in the office or between 8 and 11 p.m. at night.
So you strike me as very compassionate, very value driven, but also very much a people person. You like community. And I would think that one of the hardest parts for you going solo is the lack of community, in the sense of, who do you reach out to? Who do you talk to about these issues that are very specific about management in a pediatric office, which is different than an orthopedic office and it's different than the Starbucks?
Yeah, you hit the nail on the head. And it's actually been a little bit of a struggle because my instinct is to reach out. So when there's a problem, my instinct is just to reach out, whether it's to a private practice group forum, some other doctors that I know that are in private practice. And my husband, who is not medical, but is in the business savvy, he reminds me, slow it down, gather your thoughts, and you might know the answer. You don't have to reach out. And my instinct is to always reach out. Sometimes if I get too many opinions, it jumbles it all and it's not helpful. So
True.
It's very insightful of you, Dr. Bravo.
Did you have any mentorship when you were in the big group? Did anybody come and take you under their wing and say, let me teach you a little bit about billing or
None.
AR or how to manage in 9 years?
And none. And so this has all been honestly on the job learning.
That's usually it. Yeah.
And the
Very
thing
hard.
is, most of my preparation for Mayville was just making sure everything was ready in terms of we were in compliance legally and the credentialing, but I did not have, you don't know what you don't know until
Right.
you're in it. And
Yes.
so I guess I'll call those heartburn points. There's a lot of that right now, but I'm putting one foot in front of the other, and slowly we're tackling all the things that are needed, but it is a lot. It for sure is a lot. And the thing I've learned is there's not really a magic person coming to help you. And the funny thing is, I said to my husband about a week ago, I said, the hardest thing about all this is I've learned there's not really anybody that's going to just make sure everything's okay. And he said, man, if that's what you've learned, and through some of the heartburns of some of the business operations right now, then it's a win. I learned that 30 years ago. And so I do think it's interesting. I don't know how I didn't learn that growing up, but maybe it's just because I was never in a situation where I needed to have my own back, but
It's a different mindset.
it
Now you
is.
have your own back. Then you
Yeah.
learn. You'll learn.
The business person doesn't think of failure. They're more like a scientist in the lab. I'll invest here, and if it works out, I learn from that investment. If it doesn't work out, I learn why that was not a good choice to invest in.
Yeah. And
Absolutely.
And that's not that you can't practice medicine like that. Let me sprinkle salt on this ear infection, see if it gets better. Kid died. I learned from that. Thank God. The next time I won't sprinkle salt, I will give him amoxicillin. We're
Right.
so looking for the problem, and we're so adverse to failure, which is where you get your biggest learning experiences. But there's a good reason. We don't want to fail when we take care of kids. But you reminded me of something that one of the persons I admire very much, Don Rumsfeld, who's passed away, he used to say, they're the known unknowns, and then they're the unknowns. Then the known unknowns you can plan for because you know that you don't know, but the unknowns are the most difficult things to manage in life because you have no idea where they're going to come out of and how they're going to hit. And that is managing a business is like that. Now, let me ask you a few personal questions because I'm very interested in your experience. I regret a lot that the medical education system today is indoctrinating residents into the idea that they can only be employees and answer to somebody with an MBA. I think that is shameful on that industry. And I think it is very regressive and regretful. But what EMR system are you on?
I'm on PCC.
Okay.
And
very good product.
so it's a good product.
Excellent product.
I chose it because I was on honestly a Facebook group and I was just piddling around. Which EMR do we use? And what do people like? And I came across their product and I got good feedback from a couple of other, you know what? I actually didn't know anyone personally that used it, just looking at people's stories and what they use. And yeah, it's good. It's good. They implemented it. They helped me with making sure that business operations were credentialing and things of that nature were ready up front. And so it's good. We're right now, our biggest struggle is not the EMR, but just the front desk operations, which no one's really going to train you on that before you go out. But I'm happy with PCC, and
They have a dashboard built in. Do you use that much?
We do. We
It's
use
very
the
excellent.
dashboard. Our biggest hurdle is right now in terms of the business and the dashboard, making sure that the front desk is being, I guess I'll call it a policeman over the HMO patients, because there was an issue with me not necessarily being credentialed with every patient that we're seeing, and because the front desk wasn't being as diligent. And so we're just working on not to get in the weeds, making sure that certain parts of the dashboard are where we want them to be based on kind of payers and insurance companies.
Okay.
Yeah, it's very good.
And so you're into community. Your husband sounds like he's more like me. He just likes to get on the tractor. He don't know how the tractor turns on, but he figures it out. And he makes a huge mess at the farm. But next day he goes out and he's figured it out and how it works. That's a different personality type. It's not good. So how do you find community? How do you find support so that you can not only, you're already very successful, how do you get to the next level?
I know you guys mentioned you were at the PMI conference. And so I went to it for a day. I was working during the business hours. My husband actually went and got to meet some people. And so I went for, I think it was Saturday.
Yes, I know Sogol. She was one of our first.
Yeah. She's great. And just, even if it's just a little text or a little message on a group or seeing her stuff. So these aren't people that I'm engaging with over coffee every day. I wish there was time for that, but just knowing they're out there and the collaboration, a lot of it is over tech, but it's great. That's been helpful. I'll probably go to one of these conferences next year in person and take some time off, because I just immediately feel a connection. And right now, in a way, my hobby is just getting in and asking other people what they're doing and spending time with them.
I find what the best part of going to one of these conferences is, the PCC conference, the OP conference, is not the lectures. They're okay. They're very good usually. But going outside and talking to people, what you do about this? What can you do about that? The interactions, the community. I think that's more valuable than the entire conference, because I've taken these conferences during pandemic when it was virtual. I will never do it again. But I'll go there in person. You know,
I love that you guys are doing this. There's not enough of this out there. It's like,
we know that. Yeah.
Why are you going to go into private practice? And there's the concept of taking care of your patients and the financial. But then what about just the fact that this is, I don't know how to put the words into it. You all are the podcasters. I bet you can put together what I'm trying to say, but you're creating a culture, an environment.
That's it.
Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Creating a
community of private pediatricians.
Yeah, people love that. Parents love private pediatricians. And
we know that. Yeah.
No, but you're creating a community within your practice because you're very value, compassionate, and relationship driven. So you want a community that supports these. And you say it over and over again. You're saying it with, you want parenting groups and you call parents after hours. All that is what builds this community. But you need a community of your own. And that is, I think, is very important for practices starting out, because they make a lot of, you don't know what you don't know. And these one-off interactions, sure, you have a very specific question, I can give you the answer and, how I've seen people solve it. But it's that relationship that builds when you meet on an ongoing basis, that makes a huge difference. And that I think is very important. I really strongly urge anybody that's contemplating starting a practice to join a coaching group because it cuts a lot of the unknowns out and it just takes so much. It allows you to do things you wouldn't think you can do just because somebody says, here's 3 options, pick one and do it. And let me know next week where you're at. That I think, and it builds community, and the relationship piece is key. The dashboards are very helpful, but if you don't know what the dashboard means and how they're collecting that data and how you can turn that into actions, what do I do with it? It's nice pictures. And the problem from the techie part is, and Chip will tell you this, he's disappointed because his dashboard doesn't have enough data on it because pediatricians want less data. He's a data guy and a computer geek. He wants more data. So I think a coaching group is really the key to build community because it's very difficult to tackle all these things and it's a business that is very unlike any other.
So you need somebody to say, divert, make a right turn, make a left turn, go straight.
It's one of those things where when I'm up at 11 p.m. and my husband's, you got to just turn it off and get to bed. And I know I'm going down that road towards burnout. So
you definitely are.
What do I do about this?
You're not going to that road of burnout. Don't. Let's be positive. You got a wonderful personality. You're super smart. You got a husband that not only is your partner in your private life, but is also financially savvy. You're not going to burn out because you enjoy seeing the kids and you enjoy their relationships. And that's going to give you so much damn power in your life that you won't know how to do with it. Mm-hmm. You're not going to burn out. It's just not going to happen. Now, your kids might drive you crazy. That's a whole other conversation. Wait until you got to give them the keys to the Suburban and not know what time they're going to come home and they don't answer their text. You can't get them out of their phone. But when when it's midnight and they're not home and you text them, they don't answer.
Or if they call you at midnight, it's guaranteed a problem.
Yeah. That's when you throw up blood. Talk about burnout.
I had years before doing that because they're 3 and 6. So y'all make me feel better.
Just like that.
Man, God. I tell the parents all the time in the exam room, the best age is when they're in the crib. They can't answer back. They don't run anywhere. They're not trying to jump down the stairs head first. Once they start running, it doesn't stop. Yeah. It does not stop. You got to be on them all day. And the worst thing as a parent, I don't know if you guys will concur, is when the house all of a sudden goes silent.
Yep, just sums up.
Some trouble is happening somewhere.
Yeah.
It is just, oh no, what happened?
You have boys?
I have 2 boys, yes.
Okay, I can tell you. They're rowdy, they're noisy, they break things, they drive fast, they get into trouble. Thankfully, you don't have the drama, but it's okay. Yeah,
exactly. I'm enough. I bring them up.
I do think that having a group of like-minded people to meet with is something that is very helpful for anyone. And it's just like you were saying, the new moms greatly benefit from mom groups in your practice because they all are sharing the same problems and they're supporting each other and they're giving each other different ways of resolving it at the same problem. And it may work for one person, it may not work for another one, but just having that support makes people feel better. But as you build that relationship, that support becomes more meaningful. I think a very important lesson, especially with the brainwashing that young physicians have had, that they can't do business. If they run a business, they're going to run into the ground. They can't do private practice. They should just go be an employee and obey an MBA somewhere. That's all nonsense.
The standard line that the MBAs use, because we've been poached over the years by many systems, organizations, private equity, and so forth. This is doctor. Let us take care of the business. Do what you do best, the doctoring part. How many times have I heard that line? So what did I do about it? I got my own little MBA.
When did you do that?
When did I do that? About 5 years ago.
Yeah.
You do it online.
Value. Yeah.
You do it online.
Yeah.
I think that there's a time.
But not now.
For everything.
Not now for you.
You're like, don't go down that road.
Well, This is another of my observations about parenting. When your kids are young, they adore you and they want to be around you as much as they can.
Mm-hmm.
And drag him into the office. It's a pediatric office. Drag him into the office, give him something to draw on, and tickle them in between patients. They don't care. They just want to be near mom. As they grow older, which is the way it should be, they start developing their own friendships and their own independence. And there comes a time when they're teenagers where you actually get a lot of your personal time back because they're busy with their sports, they're busy with their friends, and you're basically the credit card machine. And it's okay.
Don't forget the chauffeur.
You want to raise independent adults. So they have to start testing that independence. But so it's very important, I think, for young parents to hear this message. You don't have to do it all today. Today, when you have 3 and 4 and 5-year-olds, focus on making money to pay their bills and focus on spending any additional time you have with your kids. When they're 12, 14, you're going to drop them off. They're going to do their baseball thing. And then you'll see them at the game because they're starting to develop that independence and you'll have time to pursue other passions because there's a time for everything.
Mm-hmm.
The problem with society, and I feel bad for women in this regard, is they're sold a bunch of baloney that they can do everything and they can do it today. No, there's a time for everything. And
you're so right.
There's a time for being a parent. There's a time for being into personal growth. Maybe it's an MBA. Maybe you're going to be a yoga instructor. I don't know. I don't know what your passion is going to be. Maybe you're going to start painting. I don't know. I don't see the future. And then there'll be a time to be a grandmother. And then there'll be a time to age and be gone. But there's a time for everything, but it's not all at the same time. You try to do everything at the same time, you won't achieve anything. You won't have any friends. You'll be neurotic. You'll be on not only Lexapro, but one of the other psych medicines, and you'll be miserable.
And you'll blame it on your career.
Right.
Yeah, you guys are so right. And that element of there's a time for everything is I didn't realize when you were asking me how I'm doing everything right now. And that's what sticks, that the sentiment there sticks in my head when I'm up doing some things at 10 p.m. for work, or when I'm late to my kid's baseball game. I'm reminding myself, this isn't forever. There's no way the administrative things I'm doing right now for Mayville are going to be forever. There's a season for it. We're a startup. This is what we chose for our family. My awesome husband is on board and he's with the kids at their baseball, and I'm not doing anything wrong. I think the lie, especially that women are given, is that you're doing something wrong and you're not there right now. Like what you can't, you're failing. And I'm reminding myself, this is a season and just take a deep breath. It's going to fall into place. But that's hard because I want to know it all and I want to control it all. But I appreciate that you put that feeling that I have into words, because that's exactly what I feel.
There's a time for everything. And if you're patient, the right time will come. And you're a very nice person and very intelligent. You're going to do great no matter what. Just be adaptable. If you have to bring the kids to your office and let them make a mess of your office, that's okay. It's a pediatric office.
And there's lollipops.
And there's lollipops, which they love. And the nurses love seeing the kids because you're a pediatric office.
Yeah.
They love kids. And you can be flexible and not have everything at once, but you can have the best of most of the things that you need at this time.
Yeah. I would say, had 2 boys, and my wife's a physician also. Okay. So we're a recipe for disaster. I would say that I was at about 85% of their events. That's not bad.
No, that's not.
I made it happen. My kids played soccer. Practice was always on a day that I was working. What do you do about that? You become the coach, pick your day of soccer practice, do it on Wednesday. Simple as that. Little things like that. Kids have, how many times do I hear from my employed physicians, oh, my kid, he has his orchestra or band recital, and I'm working, and this and that. I say, you know what you do? You call the instructor and say, When is orchestra going on? Are they going on first or are they going on last? If they're going on last, you can work and you can make it there. You
Yeah.
figure it out. You figure it out.
Yeah. Those are great tips.
Yeah.
So
You're not going to get 100%. You're not going to get 100%, but 85%, that's pretty good.
Yeah, the reality is it doesn't really matter if you show up to every game.
Well,
I don't know.
They're having fun.
I've tried to share this with some of my parents, but I'm living it in real time. And so I'm sure I'll be able to pass more on once I feel more of these things. But we can't be everything for our kids anyway. We don't want to be not present, but I think, especially with my personality, I feel like I have to be that for everybody when really they don't always need that.
They don't need that.
I have
Neither
to
does
remind
your
myself,
practice.
okay.
Neither does your practice.
Yeah.
Because if you keep wanting to do everything, you're going to go down that road and you're going to call Solgo and say, help me. And you don't want to go there.
She's not going to do. I was going to ask you something. So you opened in April and you have a physician. Is he full-time or part-time now?
He's full-time.
And you're adding a nurse practitioner. So you've grown a lot.
I did. We actually, and I don't know if y'all knew this, we decided to do 2 locations from the very beginning.
Whoa.
No. Yeah. I had patients in 2 locations of Houston. Houston is interesting where there can be a small suburb that's 10 miles outside of the med center. But if patients will settle in there, they're not going to want to drive into the med center. And I really didn't want to leave either of those populations when I left my old practice. So I decided to open the Pearland location, which is about 10 miles south of the med center first, and then the med center location several months later. So I am operating 2 locations right now. It adds the complexity of it for sure.
Yes. So that's a big win though, right? Most people struggle just to keep one location open.
Thank you.
So that's a big win. What other big wins have you had? Is it going to be a year in April then, right?
It is. So our year is April 29th. And
what other big wins have you had?
Yeah, I think adding the nurse practitioner is awesome. So just getting her comfortable with seeing patients and having her help a lot with some of the breastfeeding stuff and just really feeling like she's an integral part, that's a win. I would say managing the HR and empowering. We have the community that I'm reaching out to, but I have my inner community. And one of my medical assistants has proven herself and I'm seeing her elevate herself. And I am able to delegate some things to her. So that's a win in terms of even managing the staff schedule. So I'm unloading some stuff to her. If you're sick, please let Miranda know. Please let me know in addition to Miranda, but let her know. So I'm elevating her. So I would say that's a win. And yeah, just the engagement in the community. We have good reviews. We have a lot of families that are referring us. So I think that the growth and the engagement in the community is a win.
So personal connections are important.
Yes.
Financial benefits are important. Your flexibility. You're on vacation now, right? You have other people working for you.
Yeah.
So you can make your schedule, take off on Wednesday to stay open on. It's something like being a soccer coach. You close on Wednesday so you can stay open on Saturday
my decision.
And I think the most important thing that we have is autonomy. Nobody can tell you what to do. If you succeed, it's on you. But if you fail, it's also on you.
Yeah. And I'm learning that failure can be something I learn from and I don't have to be afraid of it.
Correct.
That's an important lesson.
Yeah.
Important lesson. But I think parenting teaches you that too.
Yeah.
You see the kids fail over and over. You know why kids can take an iPhone and learn how to use it in 2 days? They're not afraid of breaking it.
Yeah.
You take a new computer, you're like, I'm not touching that button. I don't know what that button does. What if the thing stops working? And I got to call someone to reboot it. I ain't touching that button. The kid just touches that button 10 times to see what happens. And they learn, that makes the computer not work. I won't touch it again.
Yeah.
But they have a child's mind is a beautiful thing. But yeah, I think you're doing great. It's phenomenal to see somebody succeeding like this.
Yeah, I love it.
And I think we were going to ask you, what would you wish to have had before you opened it? I think you would have wished to have a community that would have told you where the pitfalls are, right? What pitfalls to avoid when it comes to managing the practice itself.
Yeah,
That's a sense I get.
you're totally right. I think I mentioned you don't know what you don't know. And I wish I had someone to help guide me, look out for this, make sure you're doing that. But there's no way to know.
We got to talk to other people.
This community, maybe you guys someone is out there listening and might reach out and ask, what do you wish you would have known? And in fact, there's actually somebody that was in touch with me that wanted to chit chat about starting their own practice. I can share to them what I have learned and we can pay it forward.
Yeah. Paying it forward is very important. Now, what do you consider some of the biggest challenges that our pediatricians are facing out of residency these days in private practice, going into private practice?
I think the biggest thing, if you want to manage a practice that takes insurance, is just making sure you are credentialed properly and making sure that the front desk does what they are supposed to do to, goodness gracious, get a claim out.
Those are the things that the consultants help you with.
They don't.
Well, that's with the startup consultant trying to get day number 1 open live, the go live.
Yeah, and
We're supposed to help with that. We're talking about the go live is with the consultants, but then there's the other things for later.
Right. I think they don't teach you all the things about making sure the person that's doing data entry is going to do it properly. So then you get in a situation where you have to micromanage everything.
That's not good.
Yeah, I think you know that if the front desk puts an R instead of a P on a policy number, that whole claim is going to get rejected. But you don't know this until you're out in it.
So I think that to have a more positive spin on this.
Yes, thank you.
The problem, the consultant serves value. My dad always would have told you that consultant looks at your watch and tells you what time it is and then picks your wallet for it. But if you don't know how to tell time from your wristwatch, that's valuable information. They've done it 100 times. So it doesn't take them but a few seconds to figure it out. But you're paying for that knowledge that's been accumulated over hundreds of consulting gigs they've done before. But
you are so right.
And so that's important. That's important. When I take my car to the mechanic, I really don't want to know how he fixes it. I just want the thing to run.
Yeah.
Okay. That's not how a real practice is. A real living organism. And so what you need is to get back to a coaching class, because the difference between a consultant and a coaching class is when you have a problem, you have a group, a community that you go back to, that you say, I'm struggling with this. And so when you tell me that the front desk person put an R instead of a P on a claim, my first question to you is, what process do you use to hire people? What is the scoreboard that you use to let somebody know within 90 days that they're doing a great job, a mediocre job, or they don't really fit in your organization? What does PCC have that is allowing you to enter the wrong ID into the system and not verifying it for you before the darn claim goes out? Because a modern billing system won't let that happen.
Yeah, I don't think PCC, I think they catch those things before they go out.
What is your process of, so if I type in, the one that gets me is the zeros and the O's. I can never tell because these cards don't put a slash to the zero. So I know it's a zero and you can't tell, is it a zero or is it an O? They look the same.
Yeah, that's a hurdle.
And so that's a problem. If your system's set up to a pediatric practice doesn't have many same day appointments that are new, established patients. So if your system, so this is the system, is set up to auto validate your insurance, then when I put a zero as opposed to a no, it's going to say invalid number. And then it's a process and a training. I got to train that person to know you just don't skip over that. You got to fix that when the parent comes and say, I don't know, your insurance is not validating. Do I have it wrong? Let's type it in again and let's rerun it. But you have to have that scorecard so that you know what the goals are for that job description.
Yeah.
And that's, I think, what the consultant's not able to do for you because they're not there every week. They're there at one point in time. They give you a template and they expect you to go read the book and implement the template.
When you have to have the time and take the time to follow up with your staff and give them expectations and give them timely feedback. And those are a lot of the learning points that I'm feeling after being out for almost a year. They deserve that to be able to know if they're succeeding or not succeeding.
Right.
But gosh, it's hard to find the time to do that. And those are uncomfortable conversations, but that's where a lot of my growth is.
And I think accountability is important, because if I suggest something for you to do, yeah, I'll do it. And then tell you something else, yeah, I'll do it. Come back next week. Did you do it? I got busy, my practice, come back next week. Did you do it? By the fourth week, you're going to be embarrassed because they're going to keep asking you, and then you'll do it. And then you have to measure it and display it.
Yeah, I think when you're going to have to excuse me because I have a potty mouth. There's social shaming and bullying works
a little bit,
and that is not kind, it's not compassionate. But we all have egos, and so the reason why working out is best when you have a buddy or a personal trainer is because if you already paid for that personal trainer's time, you're not going to not show up to the gym because you're losing money. Or if I say to you, May, we're going to work out every Tuesday at 9 a.m. together, and I'm feeling lazy because it's cold outside. I'm like, I can't leave Dr. Sissy at the gym alone. That would be so disrespectful. So I slept over there, even though I don't want to, because I don't want to disappoint you. And the same thing happens when you are in a group of people, which is if you agree to do something and the next week comes up and you didn't do it, you feel like a tool. You do. You feel like a tool. I just
think she's in high school.
But it is, you've seen it in our coaching group, George. You feel like a tool when I call you up because you didn't do what you were supposed to do.
Actually, you did. I was supposed to make these video things on anticipatory guidance and safety and vaccines to send out to the patients at each visit. He told me, and yes, I'll do it. Yeah. A couple of weeks later, did you do it? I'll do it. I'm busy. I got a lot of things to do. And then by the fourth week, he asked me again. I said, okay, I did it. Here they are.
Right. So that's social shaming.
Yeah.
There's no other word for it. I'm just putting him on the spot. And Dr. Wani is there. Just do Dr. Wani.
And I was more embarrassed in front of her because
she's younger than us.
Yes. And I did it.
And I got all my tasks done.
I know.
The angry white man on the president's chair.
So were you guys in a coaching group together?
We run a coaching group.
We run the coaching group.
All right. We'll have to be in touch on this one.
Yeah.
For high performing practices. Yeah. And I start, like George said at the beginning of the introduction, I'm very OCD, ADD, and I'm also ASS.
Oh man, all the letters he is. I keep them level, grounded.
But I think the most important thing, and this is life teaches you by humiliating you. That's where you learn humility. And until you know yourself, you cannot be happy and you can't lead other people. And life has a way of teaching you that. And so we start with something called the Big Five, which is a personality inventory, because we want people that are conscientious, that are agreeable, and not too neurotic, because we're supposed to learn from each other. And we have someone in the group that is always saying, that can't be, that's not right. Where did you with that? You bring that kind of negative energy into a community and you just ruin the whole thing. And then I like everybody to go take a test from UPenn. I always call it the Happiness Institute, but it's Marty Seligman. He has, and I'll send you the link, but his whole approach to philosophy, and the guy's a genius, his whole approach to philosophy, his whole approach to psychology is that we have it all wrong. Psychology is not medicine. We don't spend all day looking for cancers and abnormal stuff. We need to get people to find out what is their strengths and not get them to from a PHQ-9 of 15 to a PHQ-9 of 5. We want to emulate the things that make people happy and thrive and flourish and get people to emulate that so that they're not just a little depressed, they're living their best life. And once you take it, it's a free test. And you take this test and it tells you what your character strengths are, what you're passionate about, what you're happy about. And then you just got to feed that so that you're constantly renewing yourself. And that's my philosophy. Everybody has great potential. I'm not good at a lot of things, but I'm good at others. And that's okay. I find partners who are good at the things I'm not good at so they can do that really well. Because there's a time for everything and we can never be good at everything. But I think the idea of community is extremely important. And especially when you've been brainwashed that you can't do this on your own.
Yeah. Yes, you can.
Yes, you can. And you're a prime example. Dr. Wani is another prime example. And you're right. The number one area of growth right now is physicians of all specialties leaving health systems and big
Opening up
groups and
practices.
saying, I'm going on my own because I want the joy of practicing medicine.
Yeah. We're actually going to interview a physician in June. He's leaving the system, opening up a private practice. I think it's going to be on his go live day or the day after his go live day.
Nice.
And then we're going to redo it in 6 months and then in a year to see where he's at. But
Awesome.
these stories need to be told.
Yeah.
He's in Idaho.
Yeah.
Very smart.
I met him. I know who you're talking about.
Brian.
Yeah, Brian.
Yes. I met him at a conference, community.
Yes.
See?
Yes.
He's going to be PCC.
Yeah,
Yes.
it's very good. Very good choice.
Yeah.
He needs that.
Yes.
I think PC is an excellent product for solo people because they have a little bit of a community.
They have a big community.
Now it's a big community.
They have a big community. And Chip Hart I always say Chip Hart should be the CEO of the AAP.
Yeah. Chip Hart's a sensei.
He absolutely has no shame about work the pediatricians are doing in America every day. And he promotes pediatrics. Every pediatrician should be promoting it every day of the week. He absolutely has no shame about saying pediatricians are the most wonderful people in the whole darn world. And without them, we don't have a society.
Yeah. No, I've known Chip for many years. When I graduated residency, in 96, I came into this practice and the guy said to me, "Oh, you're the young guy. Why don't you find us a computer system?" So what the heck did I know about private practice, right? So what did I do? Lycos was the new search engine back then. Search engines just came out. So I typed in pediatric practice management. What do you think popped up? PCC, filled out a contact form. They sent me a nice brochure, booklet, folder with all the stuff. I said, "Oh, this looks pretty impressive." Went to their website. It was nice. Back then, there was no really any websites of any sort. And then they sent over a laptop through this big box that they put a laptop in so you can demo the product. And who was on the other end? It was Chip Hart. And we had PCC for 20-something years. They're a great product. And Chip's a great guy. We've had him on the podcast 2 times.
Yeah.
He's going to be 3 times.
Yeah. I have a nickname for him, but I won't say it on the air.
Go ahead, tell him.
Because Chip's very funny, and we share one guilty pleasure in common. We love old Mercedes, and he lives 5 houses away from Bernie Sanders. So whenever I see him, I tell him, "How's my favorite socialist from Vermont?" And his response is, "How many socialists do you know in Vermont?" Is right now you're the only person I know in Vermont, so you are my favorite.
All right, whatever.
So let's try giving an uplifting message to those folks that might be entertaining or are going about to start this wonderful journey of private practice. What would you tell them?
I would tell them not to be afraid of their dreams, not to be afraid to fail, and not to be afraid that they have to have it all together and all figured out before starting, and that there's a community out there, and at the end of the day, it's all work in progress, and it doesn't have to be, you don't have to be a successful large practice right when you start. And that it can be baby steps. And I think we go into medicine thinking that it has to be perfect, because if we don't get perfect scores, we might not pass the test and get into med school. And it's different with business. And just to be flexible, be humble, be okay reaching out. I guess there's a balance between reaching out and then getting nervous at every minor failure. So
Right.
know that there's community out there, but that things do come in time. And
So you're working a lot, but are you happy?
yeah,
That's
for
the
sure.
most important thing, right? Look at that smile.
Yeah, I love it. I think we should end this podcast with her statement when she sent as an email to me. I just love my private practice. Now, go ahead and say it. You wrote
I
it.
just love my private practice.
You wrote it.
That's the most wonderful thing to hear.
Yep.
Thank y'all so much. This has been really a nice conversation. And yeah, it's got me thinking a lot too. So it's been therapeutic for me in a way.
Great.
All right.
Great.
Well, nice
We
meeting
really
you.
enjoy having you on the show. Thank you for your time. Time is the one commodity we can never take back. And so I always really appreciate when people come on the show and share an hour or so of their time with us.
Thank y'all so much. I
Thank
really
you.
love what y'all are doing out there. So keep it up.
Thank you.
Thank you.
Pediatric Executive Development System, or PEDS, is a dynamic, transformative program designed to accelerate the growth and development of the leaders in the field of pediatric entrepreneurship. PEDS takes a hands-on approach to problem solving, addressing real-time situations within your organization. More than a theoretical course, it is a practical platform that accelerates learning. Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.